What are fillers and how do they work? I'm going to break it down for you. There are two main categories of fillers. One category is comprised of hyaluronic acid-based fillers. So these are a gel-like substance. Hyaluronic acid is a naturally occurring sugar in all of our bodies, and they reformulate it to a clear gel-like substance so that it fits into a syringe and can be injected safely into the skin in the right hands. The other types of fillers are called biostimulatory fillers, and there's two main categories. There's polylactic acid, which is known as Sculptra, and there's calcium hydroxyapatite, which is known as Radiesse. Both of these types of fillers can also be used similarly to hyaluronic acid fillers, but for the scope of this video, we're just going to talk about hyaluronic acid-based fillers. Now, there are multiple brands of these types of fillers like Juvederm, Restylane, RHA, Belotero. There are a ton of brands. So when you go in to get filler, make sure you always ask what type of filler, what brand, and what is being used specifically in different areas of your face. Fillers are best used for restoring volume that's naturally lost over time, providing some contour to the face, and softening lines that develop with aging. Results from fillers last anywhere from 6 months to 2 years, depending on what type of filler was used and where on the face it was placed. Fillers can enhance facial structure, restore volume, and create a natural lift. Now, here is where I might place filler and why. Whenever I'm assessing a patient for filler, we always start with focusing on the mid-face. The mid-face involves the cheek area and temporal area. And this is really the sweet spot when it comes to filler, because replacing volume in the mid-face can not only help improve the look of the nasolabial folds, but it can also lift the jawline. So when you focus on the mid-face first, you might need less filler in the other areas over time. Filler in the mid-face restores volume loss that happens naturally with aging. It also helps to lift the lower face without looking puffy or overdone. Filler in the nasolabial folds is another very common location. However, you have to be super careful when injecting this area. This is a high-risk area. There is an artery called the angular artery that connects to our facial artery that then connects to our ophthalmic artery. And if this artery gets injected, it could potentially lead to blindness. And so, not to scare you, but it's just re-emphasizing how important it is to go to an injector that's skilled in their profession, that's well trained, and that fully understands facial anatomy. So again, nasolabial folds are the lines extending from the corners of your lips all the way up to the top of your nose, and injecting this area very strategically can really help to soften those deep lines. Now remember, even babies have nasolabial folds, so the goal is not to get rid of them completely, but just to help with that etching in the skin and soften the expression so that the face is looking more smooth but still expressive. One of my favorite procedures to do in the nasolabial folds is to use a filler called Belotero, and that's where we inject these folds very, very superficially, and it really just helps to hydrate the skin there so that those etched lines sort of flatten out, and it can achieve really nice, natural looking results. Now, full disclosure, I have not gone filler in my lips yet, but lips are another amazing place to consider for filler. As we get older, we know that the distance between what we call the columella, or the tip of the nose, and the cupid's bow, or the tip of the lip, will lengthen. And that lengthening contributes to our lip sort of folding in and under so that you lose less lip show. And often patients will come in and say, when I smile now, I don't have an upper lip, but I used to. And so filler can really help to lift that upper lip again and give you more lip show. We call that everting the lips. When placed strategically, filler can add subtle volume and enhance overall lip definition. It also provides some hydration so that they look more supple and less prone to cracking, especially in the dry winter months. A nice thing about filler too is it can correct asymmetry without your lips looking overfilled. So when you hear lip filler, it doesn't automatically mean duck lips or fake looking lips. There are strategic ways to place little amounts of filler in certain areas to achieve lip eversion, enhanced definition, and correct asymmetry. The last amazing place to consider filler is along the jawline and chin. Again, full disclosure, I have not had filler in this area, but I do it all the time for patients so that they can achieve a sharper angle of the jaw and a more defined chin. Filler in this area enhances jawline structure for a more sculpted, youthful look. And for those who have recessed chins, it can really help balance the profile by improving the projection of the chin. Now, here are some do's and don'ts for fillers and Botox. Do go to a board-certified dermatologist or board-certified plastic surgeon or ear, nose, and throat doctor, somebody who is very well versed in facial anatomy. Do consider starting small. If you're scared to start small. Less is more. You can always ask your doctor to use half the syringe. Just start with a little bit, and over time you can build based on your comfort level and your results. Do follow the aftercare instructions. So no dental procedures for 2 weeks after filler, especially if you had filler in the mid-face or around the mouth. Also, no rigorous massaging unless you've had Sculptra and you've been told specifically to massage. Try to avoid things that thin your blood before and after filler, like ibuprofen, ginger, garlic, ginkgo biloba. And if you're on blood thinning medications, make sure you let your doctor know before filler because you could be more prone to bruising. And lastly, we advise no heavy workouts for about 24 hours. It's really important to let the filler kind of settle into the face. And if bruising is going to erupt, it's going to probably show in that time period. So we don't want that to be any worse than it could. Now, in terms of Botox for aftercare, make sure that you don't massage your forehead or go anywhere where you have to bend over like yoga or Pilates or any sort of sauna type experience for at least 4 hours after your Botox. And that's just to ensure that the Botox doesn't migrate after it's placed. One thing we do want you to do after Botox is move your muscles around. So if you've had it placed on the upper face, you can sort of raise your brows and frown and smile and do that for the immediate 4 afters post, and that helps it get drawn up into the muscle so that it can be the most effective. In terms of Botox, don't expect immediate results. Botox takes about 2 weeks to fully kick in. Now, in those immediate days post-injection, you might notice some changes happening in your skin, but it's really not fair to assess the full effect for about 10 to 14 days after the injection. With filler, you can see immediate results, but often you're a little bit swollen and there can be some bruising, so it is important to give it some time to settle into the skin before you assess your true results. And another big don't, we've said this over and over again, don't get injections from inexperienced injectors who don't have credentials or in non-medical settings. All in all, Botox and fillers should enhance, not change your natural beauty. If you're considering injectables, always consult with your board-certified dermatologist and feel free to leave any questions in the comments below. Have you ever thought about Botox and filler? Let me know. What questions do you have? And don't forget to like, subscribe, and hit that bell for more skincare and beauty advice.